Hello, I'm Director Bang Seoung, the hair specialist who protects your hair. It's nice to see you. Today we're going to do a case review. We'll be looking at the case of a male patient in his mid-40s. The essential point of today's case review revolves around how extensively we can transplant inward and whether shock loss will indeed happen. What I mean is, when you go for a hair transplant consultation, the frontal hairline design is similar, but sometimes they don't clearly explain how far inward they will graft. The way we address the areas where existing hair is present significantly impacts the total graft count, the overall surgery cost, and ultimately the final results. There's much discussion about whether to transplant into areas that have existing thin hair. As you'll note with this particular patient, he was experiencing some M-shaped hair loss that was gradually advancing. What he desired was to fill in the M-shaped hair loss a little more and achieve a more stable hair volume so he could look younger. However, the progression of hair thinning was evident in the border area. However, he was a bit skeptical about medication treatment. He could take the medication but wasn't confident in taking it consistently. That was his case. So, since we couldn't be sure about the medication treatment, I decided to include the border area. If you look at the surgery photos, you can see I added more grafts to the right and left border areas. This increased the graft count. Usually for this kind of design, a clinic that grafts less would do about 3,000 hairs. But this photo shows our approximately 3,400 grafts. So we included the border area and transplanted more densely. When you graft that way, after about a week, the transplanted area becomes clearly visible. At this point, the transplanted area and the non-transplanted area need to overlap well. That way, even if his hair loss gets worse, that area will appear completely filled, won't it? So, looking at his progress, as time goes on, you can observe that specific area filling in and the texture becoming noticeably better. In this individual situation, he diligently maintained proper hydration and regular exercise, and consequently, by the 9th month, the outcomes were quite pleasing and appeared genuinely natural. The front hairline is now soft, and the inner hair density has been effectively filled. Most importantly, despite only 9 months passing, his original hairline is no longer discernible. This is what enables you to confidently sport hairstyles that reveal your hairline. Although the innermost areas are not yet perfect, making a hair part might still be a bit challenging, but he is now fully capable of styling his hair in a way that exposes his hairline, such as a slicked back hairstyle. He has now reached a stage where he can comfortably reveal his hair after the procedure. Thus, while it varies among clinics, it's advised not to graft into areas where existing hair is already present. Some say shock loss will inevitably occur. However, the truth is, a more effective solution involves performing the surgery with greater care and patience, ensuring a more extensive and thorough graft. Shock loss shouldn't occur, and I wish to convey that it can be prevented by a meticulous grafting process. Therefore, during your consultation, it's good to ask, "My hair is thinning here. Will you be transplanting up to this point or not?" It's advisable to verify that. If they state they don't graft in certain areas, then perhaps you might suggest that it would be beneficial if they did. Asking, "Would it be difficult to graft there?" and discussing your options is a better approach. If you proceed in that manner, you'll likely avoid future issues like diminished hair density within the transplanted area or being unable to style a hair part due to a lack of hair. Today we looked at the case of a mid-40s man with about 3,400 grafts. As I mentioned, this was a case where we achieved satisfactory results by transplanting into the border area and the original balding area. I hope this was helpful. Thank you.